Crystal, of course, has reported extensively on the continent. And Crystal, let's start with that Air Zimbabwe plane touching down this morning, because there was a lot of attention on the fact that Zimbabwe had so-called Beat South Africa to it. Of course, we got our first consignment a couple of weeks ago. We just haven't used it because it's not going to work for us necessarily.
Yes, Sally, so quite interesting, as you can know, a lot of attention and comments from the Twitter and media, people commenting on it. So 200,000 vaccines arrived in Zimbabwe this morning. It's a donation from China, and we also saw that it actually arrived with the plane that Robert Mugabe, the late Robert Mugabe, used to use. And so I think it is quite interesting. President Mnangagwa saying that for the next 48 hours, the scientists will test it, but it will be all systems go this week for the nation to receive that 200,000 frontline workers, port workers, and also other, people working on the front line to receive those vaccines. So quite a coup, I think, for Zimbabwe receiving this donation from China, and they said they will be purchasing an additional 600,000 that is set to arrive in the next few weeks, and they will see that sort of national rollout. Now, it's important to note, Sally, that Zimbabwe is a majority rural country, more than 60% of people living in the rural areas. So you will have to have quite an extensive network for that vaccine rollout to happen successfully, and to ensure that people across the country in those far-reaching areas will actually receive it. But President Mnangagwa telling the nation it's all systems go for that, Sally.
So we know, Crystal, that South Africa accounts for by far the biggest chunk of COVID-19 cases on the continent. But just sum up for us, which other countries have been hardest hit by COVID-19?
Nigeria is the other country that's been hardest hit, and we also see, interestingly enough, the bigger economies like Nigeria and South Africa, by far their numbers are bigger. The one challenge, though, Sally, and we've seen even in Zimbabwe's case, they've reported very low numbers, is the fact that testing is not so, not so accessible. So in Zimbabwe, for instance, it's about 850 Rand, and we know the economic and dire economic conditions people face. Some people simply can't afford to test, and so that is one of the issues. So Nigeria also still waiting for that vaccines. We see Senegal also had quite, they felt that they were hard hit, even though their numbers weren't that high. They've just paid for their consignment from China as well. So it is quite interesting. What I think is interesting of this, Sally, we see some countries like Rwanda also announcing they have been jabbing their frontline workers since Wednesday, and they said they received it from an international partner. They've not named the country that they actually received those jabs from. One would have assumed, Sally, that given the COVAX facility, that means equitable access to all African countries, that everyone will wait. We see now some countries going out of that COVAX facility and actually procuring vaccines on their own. And so it's quite interesting, this dynamic, each country for himself or herself when it comes to this vaccine rollout.
It's very interesting because there are a number of bodies. I mean, the African Union met earlier this month, and they were discussing vaccine rollouts. They've also developed a facility to sort of work together. The WHO's COVAX facility was meant to do exactly that as well, a sort of a joint forum to make sure the developing countries were not left behind. But it seems, is it everyone for themselves at this point?
Absolutely, Sal, and you see that Rwanda, just out of the blue, announcing they've already started their vaccination process. We see Zimbabwe now with their 200,000, and I think we've already seen Morocco also rolling out. We've seen Egypt. We also heard from Algeria. So I definitely think countries are taking a decision, Sal, each one to themselves, and trying to rescue the economy and ensure that their people have access to jobs seems to be, I think, what is happening in some of these countries.
And the whole issue of vaccine nationalism was such a big issue, and it does seem that Africa is lagging despite those best intentions. But Crystal, I have to ask you about the news that the new WTO head is from Nigeria, Ngozi Okonjo-Iweala. That was just confirmed this afternoon, the new DG of the World Trade Organization. Do you think appointments like that will help put Africa centre stage when it comes to the sort of global negotiations, or not?
I think absolutely. I mean, this is a formidable African woman. I mean, she's been the Nigerian finance minister. She's had several high-profile positions. So I think, firstly, it's a great day for Africa, having someone there. It's a very particular time for the WTO, Sally, given we know the trade wars that Trump and China had last year. We know what COVID has done to the global economy. There's been a lot of countries just simply looking inward. So it's going to be a very interesting time for the WTO while it redefines international trade. We also, for instance, see the whole COVID patent issue coming to the fore and about developing countries not having patents. So I think it's going to be fascinating to see what the new WTO head is going to do. It's not going to be easy, I think, but let's hope and give her a chance to see what she will do.
Absolutely. Thank you very much. ENCA Duty Editor and Africa Reporting Specialist, Crystal Alderson.